Heart attacks, medically known as myocardial infarctions, occur when the flow of oxygen-rich blood to a section of the heart is blocked. Nevertheless, studies have shown that in more than half of the instances, individuals might notice early warning signs up to a month prior to a heart attack. Recognizing these indicators early on can assist in obtaining prompt medical care. The most common cause, where arteries become narrowed or blocked due to the buildup of cholesterol and other substances, forming plaques. A plaque can rupture, leading to a blood clot that obstructs blood flow to the heart muscle. According to the Harvard Medical School, a survey of more than 500 women and men who survived heart attacks found that 95% of them spotted warning signs a month or so before the attack. These red flag symptoms can occur in the days, weeks, and even months before a heart attack actually occurs. The timing varies from person to person. In this video, we will list down the 10 symptoms that are often overlooked that happens 1 month before a heart attack. Just a quick disclaimer, remember the information provided is for educational purposes only and should not substitute informed medical advice or care. Starting off with the first symptom. 1. Fatigue. The survey indicates that unusual fatigue stands out as the primary early warning sign, affecting 71% of the participants who survived a heart attack. Symptoms of fatigue encompass overwhelming tiredness, diminished energy and motivation for physical and mental activities, and severe weariness. Routine activities such as bathing or tidying up your room might unexpectedly become challenging. This fatigue may result from the increased strain on your heart. When blood flow is obstructed, your heart has to work harder to pump blood, leading to feelings of exhaustion. 2. Difficulty breathing is another frequent indicator of a heart attack. It may feel as though you're unable to breathe adequately or are struggling to take in air. Wheezing or coughing might also occur. This condition arises when your heart cannot pump sufficient blood to satisfy the demands of your body. Difficulty breathing might also occur alongside symptoms such as chest pain or discomfort, exhaustion, dizziness, or nausea. If you find it hard to breathe, it's crucial to get medical help immediately. While shortness of breath can signify various health problems, it's always wise to err on the side of caution. 3. Sleep disturbance. Research in the journal Circulation highlights that sleep disturbances, including insomnia or sleeping more than usual, were reported by heart attack patients in the weeks leading up to their event. These changes in sleep patterns could be the body's way of signaling heart trouble. 4. Gastrointestinal discomfort. This symptom is more common among females and older adults. It's not just any abdominal pain, it's a type of discomfort that might resemble gastritis but isn't. You may experience stomach bloating during or after eating, or pain while walking or exerting yourself. These instances are crucial for recognizing that the underlying issue might be cardiac-related, not gastrointestinal, especially if you're at a higher risk for atherosclerosis. Risk factors include being over 50, though it can happen at any age, diabetes, high blood pressure, obesity, particularly excessive visceral fat, smoking, or consistent exposure to secondhand smoke. If this description fits your experience, especially if you have the mentioned risk factors, I strongly advise not to ignore these signs. They could be your body's way of signaling an impending heart attack. Early recognition could be vital for saving your heart and possibly your life. Do not underestimate the importance of these symptoms. 5. Back discomfort. Discomfort around the scapula or the lower neck area, especially on the left side, could precede a heart attack or indicate an issue with the aorta, one of our body's largest arteries. It might be tempting to dismiss this as simple muscle pain, but caution is necessary. If the discomfort doesn't alleviate with position changes or self-massage, it might indicate a more severe issue. Unlike typical muscle soreness, this pain persists and doesn't respond to common remedies. The aorta plays a crucial role in delivering blood to nearly all parts of our body. Conditions that weaken its wall can lead to the development of ulcers or tears, causing intense pain between the shoulder blades. Such conditions involving the aorta are emergencies and demand immediate medical intervention. If you're experiencing this type of back discomfort, especially if it's a new symptom and unresponsive to standard treatments, it's important to consider the possibility of a heart or aortic issue. The pain linked to heart or aortic problems is distinct and severe. In aortic conditions, the pain is sharp, as if something is piercing from the front of the chest through to the back. However, when related to a potential heart attack, the pain tends to be less intense but still significant, resembling a persistent pressure in the back. It's usually not constant; instead, it comes and goes, generally lasting only a few minutes at a time. If you encounter this type of pressure, like 6. Anxiety, an increase in anxiety or feeling of impending doom can precede a heart attack. According to a study in the journal Psychosomatic Medicine, some patients reported feeling unusually anxious before their heart attack, which could be related to subconscious awareness of the body's distress. 7. Chest discomfort. The most recognized symptom of a heart attack is chest pain or discomfort. However, it can start as a mild discomfort that comes and goes in the weeks before the heart attack, becoming more intense as the event approaches. 8. Arm or shoulder pain. Discomfort or pain radiating to the shoulder, arm, back, or neck can be a sign of a heart attack. The American Heart Association explains that this happens because the heart and these areas share the same nerve pathways. 9. Sweating. In fact, up to 30% of individuals who've had a heart attack reported experiencing this in the days leading up to the event. But what sets this apart from normal sweating? When experiencing a cold sweat related to heart issues, it appears suddenly and is markedly different from the sweat produced when you're hot or engaged in physical activity. It's sticky and cold, often accompanied by a feeling of chilliness on the forehead or throughout the body, and you might notice a sudden paleness in your skin. This symptom can come and go, resolving spontaneously within a few minutes, and it can occur at any time, while at rest, eating, or during any routine activity. What's more, it tends to happen repeatedly before a heart attack occurs. If you notice this kind of cold sweat and paleness, especially if it happens multiple times, it's crucial to take it seriously. These are not ordinary symptoms. They could be indicating that your heart is in distress. Seeking medical attention promptly could be vital in preventing a heart attack. 10. Swelling. Fluid retention in the body can cause swelling in the legs, ankles, feet, or abdomen. The American Heart Association states this can happen when the heart isn't pumping effectively, leading to fluid buildup. 11. Palpitations. Experiencing heart palpitations or feeling like the heart is racing or skipping beats can be a precursor to a heart attack. The Heart Rhythm Society suggests that palpitations can be due to abnormal heart rhythms that are a sign of heart disease. As we wrap up our exploration of the 10 symptoms that can signal a heart attack up to a month in advance, it's crucial to remember that knowledge is power. Understanding and recognizing these early warning signs can be the difference between life and death. Heart health is not something to take lightly, and being proactive about any unusual changes in your body is key to prevention and early treatment. If you notice any of these symptoms in yourself or someone close to you, don't hesitate to seek medical advice. It's always better to err on the side of caution when it comes to your health. Remember, heart attacks can be survivable and even preventable with the right care and attention to your body's signals. Let's not forget to support each other in maintaining heart-healthy lifestyles, including regular exercise, a balanced diet, and stress management, which can all contribute to reducing the risk of heart disease. Share this information with your loved ones. It could potentially save a life. Stay informed, stay vigilant, and take care of your heart. It's the only one you've got.